Okay, I'll be the one to introduce Dr. Brian as he comes and does his presentation. So, Dr. Brian or Dr. Isaac is somewhat of an island celebrity on Pohnpei. You've either got sick and went to him as an appointment, or you've seen him on the tennis courts. So, Dr. Isaac was born in Kosrae on March 29, 1952. He had his education in Lela Elementary School and went to Kosrae High School for freshman to junior, but finished his senior school year in San Diego, Chula Vista High School, earned the AFS scholarship, and then he moved on to Hawaii Manoa University in 1977 and earned his bachelor degree in psychology. Then he moved to pre-medical school in Imi'o'ola in 1979 to 81, 2 years, and then moved to John Burns School of Medicine and got his master's degree there. And later on in 1986 to 89, he got his internal medicine diploma, and from 1989 to 1990, he did his surgical residency for 6 months, pediatrics residency for 3 months, and OBGYN residency for another 3 months. His jobs that he used to have was, he used to be a science teacher at Kosrae High School for 1 semester in 1977, and he also taught at Pix High School from 78 to 79, and he was also associate professor for Pacific Basin Medical Officers Program from 1990 to 1995. He was also a tutor for medical students and residents from U.S. Medical School, and now he's a doctor and owner of the Pohnpei Family Health Clinic, still working today. So, without further ado, I'll give the floor to Dr. Isaac.
I think I'm going to be forced to use the mic because I thought we'd be just a small group like the last time I came, on the up front. But now it's all the way to the back, so I really don't like to use mics for that. Okay. How do I say it? Rana name? I don't know how to say good afternoon yet, so I say Mogodil, Canceleria. What's the word for Kosrae? Rainbow. When Penina asked me to do something with regard to this diabetes thing, access thing, I said, that's not very a good idea. That's not a good topic to talk about. I'd rather talk about diabetes. At least it will help some of you understand it, maybe hopefully preventing it. So that's what I decided to do, talk about diabetes mellitus. Okay? Maybe some of my slides may be a little bit too detailed, but I think they're important for you guys to understand what I'm going to be talking about. Before, hang on, there, I can see you better now. Before I do my presentation, I have a pop quiz. I want to see how you guys understand, so I can gauge my presentation appropriately. How many agree that diabetes was recently diagnosed about 100 years ago? Raise your hands. Nobody? That's good, because that's not true. It's as old as, older than, well, I'll show a slide coming up when diabetes was first addressed by health providers. There are only 2 types of diabetes. True or false? Say true, raise your hands. Okay, answer is false. Diabetes mellitus is the same as diabetes insipidus. True or false?
False.
Okay, what's the other type of diabetes? That's okay, I'll bring it up later. Diabetes run in families. True or false? False. There's a small percentage are genetically predetermined, but most diabetes type mellitus is due to our lifestyles. Okay? Once you get diabetes, it stays with you the rest of your life. False. Very good. I hear more false then. That's true. I'll mention it later, but diabetes mellitus is curable. Simple starch has nothing to do with diabetes. False? Okay, good. These local foods are examples of simple starch. True or false? True?
True.
Bread is simple starch. These are local, natural. They're complex starch. You know who Dr. Linus Pauling was? No? Well, he was not the one that diagnosed diabetes. Diabetes, I'll show on my next slide, has been addressed more than 7,000 years ago. Way before even Jesus was born. Okay? But Linus Pauling was the one that discovered vitamin C, which is good for you. Okay? Okay, so this is my short presentation, the brief outline. I'll go over what diabetes is, how many types of diabetes are there, how does diabetes mellitus develop, and then you already answered that one. Is diabetes curable? Yes. Diabetes mellitus, the other types of diabetes that I'll bring up, some, especially the one that is called juvenile type diabetes, it's not curable. That population needs insulin to use the rest of their lives. Okay? So what is diabetes mellitus? Like I said, more than 7,000 years ago, the Egyptians were the first one to address this disease. Okay, and they call it diabetes. Diabetes has nothing to do with sugar. I'll show you in the next few slides what diabetes means. You know what straddling is? When you straddle on something, you stand like this. Sitting on like a horses or a chair. And that's what diabetes in Egyptian word means. When people, they name it diabetes because they notice that people with sugar problem, they stand like this, straddle and pee a lot. That's what diabetes is, that straddling. It has nothing to do with sugar. Okay? And people with that disease do that, and they also, because of diabetes, because of the sugar problem, they lose weight. So if you know some diabetics in your family, you notice that they lose weight, lose muscles, get weaker and weaker. Mellitus was later added on by the Greek health providers. It's a Latin word, means honey, sweet. So that's what is associated with diabetes. People stand like this, pee a lot. You won't believe it, but before we were able to test blood and urine, stuff like that for sugar, the doctors in the poor old days used to taste the urine, see whether it's sweet. The other way they do it, because they leave the urine on their lap, counter, wait for the ants to go. If the ants go there, it's sweet. But they actually, some doctors used to actually taste to see whether it's sweet. We're very lucky these days we don't have to do that anymore. There's so many diabetics. I'm going to be tired of tasting urine. Okay. So that's what diabetes mellitus is. It is the commonest type of diabetes. There are several types, I'll bring it up. Now you know what diabetes mellitus means. Okay? That's straddling. Okay? Just a picture to just reinforce what I just showed you. So, current understanding of what brings on diabetes mellitus is this. How many of you have taken biology? All of you. You know where the pancreas is? Yeah, the anatomy of the internal organs. So, supposedly, well, we know that insulin is the hormone that controls, keep our blood sugar normal. Every time you eat something sweet, I'll show you a graph coming up, your blood sugar hit the roof and insulin is injected to bring it down. Okay? And if that keeps happening, you keep drinking sodas, you keep eating bread, donut, cake, you keep doing this over a 24 hours period, you're going to eventually run out your insulin supply. That's the current thinking. But there is a more recent thinking based on research that I will show. So when you keep doing that, when the insulin source is getting compromised, you develop insulin resistance. The insulin is no longer effective. Okay? And if you don't get that fixed, like what a lot of our people are doing, keep drinking sweets, keep eating sweets, they overwhelm the insulin system, you develop insulin resistance. If you don't correct that, you develop diabetes mellitus. Any questions so far? If I'm talking too fast or not clear, you raise your hand. Let me clarify. I put this up, just a comment that we call diabetes a sugar disease. It's actually not a sugar disease. It's a disease due to glucose. The reason I say that is we have more than 60 different types of sugar. And it's glucose that causes diabetes that we're aware of, that we know. I'm just labeling it. We should call it glucose disease, not sugar disease. That's all sugars. 62 different types of sugars. And glucose is the one that causes diabetes mellitus. So if you agree with me, we'll write up a new paper and say it's not sugar disease, it's glucose disease. I already went over this. Too much sugar overwhelmed the insulin system. This is what happens when we eat. The red solid line is the level of blood sugar, blood glucose. I keep confusing sugar. Blood glucose in the blood after we eat. That's morning breakfast, lunch, dinner, and nighttime is the lower flat ones. If you eat a sweet breakfast, that's what happened to your blood sugar. The blue line is insulin in response. It goes up, bring the sugar down. You eat lunch, your glucose goes up, insulin is released, bring it down. Same thing happened after dinner. But if you keep consuming sweets in between, imagine what's happening to this curve. It's going to stay up, and insulin is staying up, trying to bring it down. That's how you develop insulin resistance. If you don't fix it, you develop diabetes. Clear? Our cells, you know what a receptor is, yeah? Something that receives something. So our cells have different types of receptors for different chemicals. It has insulin receptors. When your blood sugar goes up, insulin is stimulate the receptors, insulin receptors, to open up the gates to allow sugar to go into the cells. And if they keep happening like that, those receptors are going to get pooped out. So blood sugar, instead of going into the cells, stay in the blood, elevating the blood sugar. That's how the diabetes mellitus develop. Clear so far? It's just a big cartoon picture of what I just said. This is like supposed to be the semicircular one is the cell membrane of a cell. That's a cell, the part of it. The red dots are blood glucose. The blue dots are insulin molecules. So what happens here? It says insulin resistance. You see some of the glucose gates are not open. It becomes resistant to insulin. So the blood sugar, keep saying sugar, the blood glucose ending up piling up in the blood. That's what we measure when we check on our diabetic patients. So this is a picture of like what is called insulin resistance. The other name for insulin resistance is pre-diabetes, the step before developing real diabetes. This is the latest. I said there are some more recent studies. Problem is they always use animals to study first. So this is a study done on rats. And the current thinking is that, okay, you know the anatomy of a cell, right? There's cell membrane, there's cytoplasm, there's ribosome, lysosome, endoplasmic reticulum, the nucleus and the nucleolus. That's the anatomy of a cell. It's the endoplasmic reticulum that is now supposed to be understood to help manage diabetes. When the endoplasmic reticulum, there are two types, smooth and rough type. They're like the factory for the cells. They make nutrients for the cells. And in totality, our body nutrient. So if we keep bombarding that factory, they'll send message to the cell membrane to shut the insulin receptors. And that's how diabetes is supposed to be developed, diabetes mellitus. Clear? Okay. So, how many types of diabetes are there? 2? I already said false. 3? False. 4? Okay. First one is diabetes mellitus. That's the one I've been talking about. Second one, I mentioned it, juvenile onset diabetes, also called insulin-dependent diabetes. Means people with this, they need to have insulin. Their body cannot make enough insulin to handle their sugar. And that usually happens in early in life. That's why it's called juvenile. Usually seen in early teenage years. And there's gestational diabetes. What is that? Diabetes developed during pregnancy. That can be resolved, but if the person with gestational diabetes is not careful, she can develop diabetes mellitus later on in life. So gestational diabetes during pregnancy. This is a funny name for diabetes. It's MODY. So it stands for maturity onset diabetes of the young. That's the group of diabetics that develop adult type diabetes in less than 25 years of age. And that is similar to adult diabetes. They need the same kind of medicine that we use. I have several patients here in this category. So what is diabetes insipidus? It has nothing to do with sugar problem or glucose. Wait, it's coming up later. So the other labels for type 2 diabetes that we see mostly in adults is like diabetes mellitus 2 or diabetes mellitus type 2, T2, or adult onset diabetes mellitus and non-insulin dependent type diabetes. These are all terms that doctors use to refer to type 2 diabetes. I don't know if I should have put this up, but I'm just putting it up saying if you have a normal liver function and normal kidney function, there's no need to use insulin unless it runs out of control. You can use oral medications. There are many, many different classes of oral medications now available to treat diabetes type 2. So, diabetes type 2, like I said, is a lifestyle disease. So are the other non-communicable diseases, the NCDs. High blood pressure, heart disease, cholesterol problem. These are all lifestyle diseases that can be reversed if the patient make up their mind to do something about it. And we don't need to rely on medications all the time. Okay. The other, I don't know if you know, but other cause of weight gain or gaining weight is like stress, staying up too late at night, lack of exercise. When you stay up too late playing your video games, you tend to reach for snacks, and then you don't know, but your body releases this hormone called cortisol, that is called a stress hormone, that makes your cells become, your fat cells become healthy cells. They get bigger and bigger and bigger. That's how we gain weight. Okay? Some medications that we use can also cause weight gain, especially steroids. The steroids can also make you become susceptible to diabetes. You gain weight, and even some of the medicines we use to treat diabetes can contribute to weight gain, like insulin. Insulin itself can cause weight gain by encouraging healthy fat cells. Most people don't know, so they try to take insulin instead of exercise. Okay? Some medications also can injure the liver, and liver is the main organ that helps us maintain healthy blood sugar, along with the pancreas. Some medications, like medications that we use to control cholesterol, can damage some of the liver functions, some of the liver processes that encourages diabetes development. I'm just showing this. I have two slides like this. One, this is what our people look like before the Americans come and take over our country. After the World War II, the US sent a team of American doctors to study the health of the islanders. Their final conclusion was the islanders are lean, mean, and healthy. Is this the same? Lean, mean, and healthy? All the ones I put stars on are Micronesians, islanders. This is a team that when doing NCD conference in Hawaii, and I stole this picture from somebody. If you know them, don't tell them, they might sue me. But definitely we're no longer lean, mean, and healthy. And just weight gain, getting obese, is one of the cause of all these NCDs that we have. including diabetes. Okay, gestational diabetes is just part of, some women are prone to it, part of being pregnant. Some crazy thinking is that maybe the enlarging uterus is pressing on the pancreas, causing problem to that. But it tends to run in family too. If you have a family member and sister that had gestational diabetes and you're pregnant, you probably will develop that. But if you observe good lifestyles, it doesn't have to happen. Who knows what PCOS is? It's a polycystic ovarian syndrome. Men don't have this one. We don't have ovaries. But it is a problem with women when you have your period regularly every month, because one egg is maturing and released and go and wait to be fertilized. But if it's not fertilized, you lose it, and the leftover tissue produce this hormone called progesterone that maintains the inside lining of the uterus. If that egg is not fertilized, the progesterone source also degenerate, and that's when you bleed. Some women don't release the eggs when they're developing in the ovary, because sometimes the capsule of the ovary is too tough. So although it's mature, but the egg is not released, so that process doesn't happen. So most women go to 2-3 cycles that have this problem, polycystic PCOS. Usually miss 2-3 months of cycles. Okay? And these women with PCOS tend to have high blood pressure, their sugar, pre-diabetes state, and if they don't do something about it, they can eventually develop diabetes also. Poly means many. Cystic means the cyst. So polycystic. So when those eggs are not released, they end up staying small cyst in the ovary. Okay. Just juvenile onset type diabetes. It is diabetes that develops because of lack of insulin. It is understood to be an autoimmune disease. Our own immune system mistakenly attack our body. There are other different types of autoimmune disease. Diabetes is also one. Thyroid problem is also one. Our immune system mistakenly attack our own normal tissues, bringing on this kind of problem. So those people, the insulin manufacturing system is attacked by our immune system, killing what are called the beta cells. Who knows what's the name of that system that produces insulin in the pancreas? What's that? I thought I heard it. The islets of Langerhans? Yeah. Beta cells is one of the cells in there that produce insulin for us, and our autoimmune system attacks it. And they're not, the juvenile type diabetes don't benefit from oral hypoglycemics, medicine we use in adult type diabetes. They need insulin. So insulin is just a protein molecule that is producing that skinny, long, red thing is the pancreas, right below the stomach. This is the enlargement of part of the pancreas, that islet of Langerhans. And the beta cells are the ones that produce insulin. That I already mentioned, it was the MODI. It's a juvenile onset adult type diabetes. They need regular medications. They don't need insulin. So diabetes insipidus, I said, it has nothing to do with what we're talking about. The word insipidus means tasteless. These people with this disease, they pee a lot, just like diabetics, because they don't have the hormone that tells them to stop peeing. And they get dehydrated very easy. So what they need is the replacement of that anti-diuretic hormone produced in the brain to help them stop peeing. So just remember, it does not have anything to do with what we're talking about. I guess they do the same. They stand like this. That's why they call it diabetes. The urine doesn't have any sugar taste. I think I already mentioned that diabetes mellitus is preventable with proper lifestyles. It's curable with proper lifestyles, but if it's really bad, we use medicine to help bring it down. For myself, when I treat my diabetic patients, when it's really high, I use medicine. And there's a test that we now use, it's called hemoglobin A1C, that categorizes the level of blood sugar over a 3-month period. If I do it on you today, it will tell me your average daily blood sugar level from 3 months up until today. And the normal is up to 5.7. If you have below that, I don't worry about you. From 5.8 to 6.3 is pre-diabetes or diabetes under good control. And when it's at that level, I stop using medicine. I challenge the patient to do it on their own. I have more than 15 people here no longer have diabetes doing this. So I have proof that it is curable. And you go Google it, is diabetes curable? You have a big yes. Remember, diabetes mellitus, not diabetes insipidus. This is all I have for you today. Thank you very much for attending. I hope it helps. Any questions?
What distinguishes MODI from adult onset?
The years.
Age?
The years.
Just the age?
Younger than 25 developing type 2 is MODI.
Is it thought to be a different mechanism?
It's the same mechanism that causes type 2, but in the younger population. Yeah.
Does that mean things like fructose and the galactose and those do not directly contribute, or do they break down the glucose?
Yes, because glucose is a simple one molecule, but those are more complex molecules, glucose in them, but when the body breaks those down, glucose is part of that. No more questions? Thank you very much for listening.